Welcome to today's webinar, Brain Injury and the Veteran Population, Utilizing Defense and Veterans Brain Injury Center Supports to Promote Positive Outcomes. I am Carla Giovanniello, Brain Injury Training and Services Project Director here at the Association. Thank you for joining us. Before we begin, a few housekeeping details. Because of limited time, we ask that you please hold your questions until the end of the presentation. During the question and answer session, questions can be submitted via the question text box. The text box option should be visible to you on the GoToWebinar toolbar on your desktop. If you are having trouble viewing this option, please contact Citrix Tech Support at 1-800-263-6317. Again, that number is 1-800-263-6317. This number should also be visible on your toolbar. Our speaker will do his best to answer questions in the order that they are received. Any questions he is unable to address may be submitted via email to the Association. Like always, we will be recording this webinar session and plan to post it along with the presentation slides to our website, www.bianys.org. Information about contacting the Association and viewing the webinar will be provided in a follow-up email after the presentation has ended. My contact information will also be included in those follow-up messages. Before I turn the microphone over to Jose, let us begin with a quick poll to see who is in our audience today. Please take a moment to answer the question. I am launching the poll now. I'll give you about 5 more seconds to answer. All right, I'm going to close the poll and share the results. So it looks like most of you are affiliated with a brain injury program or organization. We do have a good amount of individuals that are healthcare professionals or caseworkers or that are affiliated with a veterans organization. And we have a large number again in that other section. I do always like to know who you are. So if you'd like to send me a message just letting me know who you are affiliated with, I would really appreciate it. But we do have some variety. I love to see that. I want to thank you all again for your participation and for helping to spread the word about our monthly webinars. Your support is truly appreciated. Now it is with sincere pleasure that I introduce our presenter for today, José Luis Otero. José Luis is Regional Education Coordinator for the Defense and Veterans Brain Injury Center. During the last 4 years, he has also worked as a Community Integration Specialist and Recreational Activities Director. José Luis currently works in the Northeast states of Connecticut, Delaware, Massachusetts, Maine, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, and Vermont, providing community awareness and prevention, healthcare provider education, patient and family education, and professional and ancillary staff education. José Luis, good afternoon. How are you?
Good. Thank you very much. Okay. Well, hello and greetings, and thank you, Ms. Giovanniello. I can tell you that I feel privileged to present here today, and also for being able to represent Defense and Veterans Brain Injury Center, or DVBIC. I'd also like to thank the staff from DVBIC that were able to contribute to this presentation today in the so many ways that they have. This presentation is a demonstration of our overall network collaboration. I hope today that the audience listening, whether you're a provider, a caregiver, or a survivor, you will be informed on the many ways that DVBIC works within the military system, the VA, and many other collaborations in promoting positive outcomes. We will cover a lot of information very briefly within the next hour and something minutes that we have. And I wish we had more time because some of the topics that we will briefly touch on today are topics or webinars themselves. But before we go on much further, I must disclose that the views expressed in this presentation are mine, and they do not reflect the official policy of the Department of Defense or of the United States government. DVBIC has been working with the Department of Defense for over 20 years. Back in 1991, it was established as a DoD organization by the Defense Appropriation Bill in '91. And at that point in time, DVBIC was directed to track and evaluate head injury survivors, ensure appropriate treatment and rehabilitation, study treatment outcomes, and counsel family members. DVBIC's mission is to serve active duty military, their beneficiaries, and veterans with traumatic brain injuries, TBIs, through state-of-the-art clinical care, innovative clinical research initiatives, and educational programs, and support for the Force Health Protection Services. DVBIC fulfills its mission through the ongoing collaboration with the DoD, military services, treatment facilities, Department of Veteran Affairs, various civilian health partners, local communities, families, and the individuals with the traumatic brain injury. Below here, you can see our network map, and shortly I will review our site locations and spend some time going over the network. Now, it's also important to know that DVBIC assists the DoD and the VA in optimizing care for service members and veterans who have sustained a TBI in the deployed and non-deployed settings through our three divisions, which are research, clinical affairs, and education. With these three divisions, again, research, clinical affairs, and education, today, though, I will focus on some of the bullet points for each of this division. In research division, we will cover 2 current congressionally mandated studies in which service members and veterans can be a part of. In the clinical affairs division, we will talk about some clinical guidelines and recommendations, the latest TBI surveillance report, the multidisciplinary approach, the Neurorehabilitation and Community Reintegration Centers in Charlottesville, Virginia, and Johnstown, Pennsylvania have used, and we'll also talk about the regional care coordination. In the education division, we will talk about the tools, resources, and the training that is available for all. DVBIC supports its service members, veterans, families, and providers, as I had mentioned, and we're able to do this via our 18 network sites, which can be military treatment facilities, or MTFs, VA medical centers, or in the community settings. If you go to our webpage, you can click on DVBIC Locations tab and on the upper right banner, and you'll find a map similar to this one with a listing of our sites. I'm going to go over our military medical centers. We have one located in Camp Lejeune, North Carolina, Camp Pendleton, California, Fort Belvoir, Virginia, Fort Bragg, Fort Carson, Fort Hood out in Texas, Alaska as well, Joint Base Elmendorf, Richardson Base, Navy Medical Center in San Diego, or San Antonio, MMC, or out at Walter Reed. And we also have staff at Veteran Affairs hospitals. For example, Boston, Minneapolis, Palo Alto, Richmond, and Tampa, Florida. And of course, our 2 civilian sites, which are located in Charlottesville, Virginia, and Johnstown, Pennsylvania. And a very important location that I want to mention to you, you can see on this map on the right corner, is our international military location, which is located in Lonsdale. And that's the Lonsdale Regional Medical Center. So as you can see on our map, DVBIC is a part of the United States military health system. Specifically, it is the TBI operational component of the Defense Centers of Excellence for the Psychological Health and Traumatic Brain Injury. It's also known as DECO. Yeah. Okay. So let's jump into this, the Clinical Affairs Division. Now, 2 slides ago, when I mentioned, the 3 divisions, since there were a lot of bullet points, I want to only focus again on these primary clinical aspects. I'd like to share with you the latest clinical guidelines recommendations. What are the amounts of TBIs reported in each military branch as of February of this year, 2013? That's a TBI surveillance report. And again, on the 2 neurorehabilitation community integration sites and a multidisciplinary approach. And lastly, within this section, we're going to speak about the Regional Care Coordination Program and how it's set up as a system that ensures service members and veterans with TBIs have access to appropriate medical care, support, and available resources throughout the recovery process. So here we are. Listed are the 3 clinical recommendations that we are going to review today and how you'll be able to have access to these. We have the assessment and management of visual dysfunction associated with MTBI, assessment and management of dizziness associated with MTBI, indications and conditions for neuroendocrine dysfunction screening post-MTBI. Now, these 3 and other recommendations are available on our website. They are available as training slides or reference cards, and you can find these under the section for concussion, MTBI information, and tools for providers, or you can copy and paste the link provided here on your internet browser. Okay, so let's talk about the visual dysfunction and how it can be the result of either direct trauma to the eye, orbit, as well as from neurologic injury following the concussion, blast exposure, or other head trauma. This assessment and management of visual dysfunction, this clinical recommendation is intended for healthcare professionals in the Department of Defense, primary and specialty care, who assess and manage the care of patients complaining of visual disturbances. And as we know, this is a major concern that can negatively impact a service member's health, unit readiness, and overall mission accomplishment. It is designed to assist the providers in that diagnostic process. It provides pathways for specialty referrals for patients complaining of those visual disturbances following the mild traumatic brain injury. Included within this document is the clinical algorithm that addresses red and yellow flags, identifying comorbidities, basic visual assessment, and referral options. The education slide deck available on our site contains the introductory materials for those who are new to the subject of visual dysfunction associated with mild traumatic brain injury. However, it is assumed that the reader has a basic knowledge of traumatic brain injury, including assessment, treatment, and differentiation between mild, moderate, and severe TBI. So since we know that dizziness is a common symptom following mild traumatic brain injury, and it can have significant impact on the quality of life of service members, the common causes of these dizziness, and this is all included within the training module, is the common causes, the temporal bone fractures, or central lesions, or BPPV, or the labyrinthine concussion. Again, this clinical recommendation is intended for use in the care of patients with the persistent dizziness symptoms. And this is similarly to, I'm sorry guys, I must have jumped around, I apologize. I was in the visual dysfunction, let me back up one. I apologize, audience. Okay, yeah, so let's stick here with dizziness then. Since dizziness, again, is a common symptom, the role of the clinical algorithm for this is to obtain a patient history specific to dizziness, assess for any of the red flags, conduct focused diagnostic exams for vertigo, disequilibrium, or lightheadedness, or diagnose or provide appropriate referrals. And just like the visual dysfunction one, this slide deck, the training modules that are available is as an introduction to dizziness. But the prior knowledge of mild traumatic brain injury is assumed for the reader to have, including the assessment, treatment, and differentiation between the two. Here's another screenshot of the assessment for dizziness associated with MTBI, and that's including this clinical algorithm addressing the red flags, medication side effects, or polypharmacy issues, overall patient management, and referral options. The next clinical recommendation I'd like to review is the indications and conditions for neuroendocrine dysfunction screening post-MTBI. And like the other 2 clinical recommendations, this is also available as training modules. This training module that is set up for the clinical recommendation is available on our website as well. And its objective for the learner is to describe the basic pathophysiology of neuroendocrine dysfunction as it relates to mild traumatic brain injury, including two primary endocrine glands that are affected during a blast injury. It's also intended to identify at least 5 symptoms that differentiate NED from persistent mild TBI systems. It also will help you identify the major criteria for endocrinology referral among patients with strong suspicion of NED. So now that I shared a few of the objectives of this recommendation, let me also share with you what this recommendation is not intended for. This clinical recommendation described in this education module is not intended for the use for the moderate to severe TBI patient population and patients with acute endocrine disorders, including adrenal crisis or hypoglycemic coma. This education module is not relevant to patients seen in an acute inpatient setting and should not be used for screening other symptoms or disorders of the endocrine system. Again, you can go on to our webpage and take a further look at what they may be. Okay, so moving along here, let's talk now about TBI surveillance and the clinical overall affairs with this division. So what is it? Who creates it? And what are the numbers? DVBIC is the DoD's Office of Responsibility for tracking TBI data in the United States military. Our website provides numbers for service members diagnosed with TBI since the year 2000, listed in total and identified by service and injury severity. The numbers are updated each quarter, and they represent medical diagnoses of TBI that occurred anywhere United States forces are located, including the continental United States and outside OCONUS. The diagnosis and severity of injury were determined using ICD-9 codes. And importantly, these numbers are not all deployment related. Actually, over 80% of TBIs occur in a non-deployed setting. And common causes of traumatic brain injury include crashes in privately owned and military vehicles, falls, sports, recreation activities, and also military training. I've provided a quick link which you can copy and paste on your web browser here. So with that said in mind, before we actually get into the numbers, I'd like to know from the audience, what is the total amount of the TBIs recorded within the DoD since the year 2000?
All right, I'm going to launch that poll question now. Please take a moment to answer. Give you about 5 more seconds. All right, I'm going to close the poll and share the results. It looks like 60% answered 260,000. The next highest percentage answered 26,000. And then 13% said 2.6 million, and 3% said 2,600. Jose, I can't hear you. I don't know if you're talking right now.
Is that better?
Yes, thank you.
Okay. So again, the total then of all TBIs from 2000 to 2012 was 266,810. And shortly, again, we're going to explore the numbers for each branch. But before we go on, I want to talk about the data. I'm one of those data people that like to know how the data was gathered and how often is it updated and errors and things of that nature. So the data is provided by the Armed Forces Health Surveillance Center using on the Defense Medical Surveillance System and the Theater Medical Data Store. By case definition, a case of TBI is defined based on MHS TBI coding guidance. That's in the Appendix G, TBI from the Military Health System and Coding Guidance for Professional Services and Specialty Coding Guidelines. That version is 3.2. Now, for the first inpatient or outpatient TBI encounter, individuals with multiple TBI healthcare encounters are included only once. An individual is considered an incident case only once per lifetime. The severity categories, which we'll cover here shortly, the severity categories are ranked from more to less severe, with the highest level of severity documented determining the severity category classification used for that patient. And the date for the initial TBI medical encounter determines the calendar year in which they are considered an incident case. In the updated schedule, well, case counts for the current year and immediate past calendar year are updated quarterly. For all other years, case counts are updated annually to reflect changes in medical information. Okay, so now looking at Army individually, we can see that there have been 155,282, which includes active duty guard and reserves. This is a nice visual breakdown of the component, severity, and the total amount diagnosed TBIs, where you can see that the mild traumatic brain injury is the most common between the active, guard, and reserves. Here would be the mild. Okay. Now for the Navy. Here's the Navy totals, 36,370, including active and reserves. Here's another nice breakdown for the active reserves within the Navy. And as you can see, the majority of the severity between the active duty and the reserve units, again, is mild TBI, with the active duty side being at 27,611, and with the reserve side being 2,279. Air Force, total number of TBIs diagnosed, 36,349. Again, most of the injuries occurring on the active duty side. Here's the individual breakdown from active, guard, or reserve. Again, mild being at 26,654 for active, 2,821 for the guard, and 1,628 for the reserves. Marine Corps, United States Marine Corps, 38,809. 35,000, a little bit over that, being in the active duty side. Here's a breakdown of those numbers for you. Again, leading the mild traumatic brain injuries, 29,306, active duty side, and the reserve side being at 2,815. Okay, before I do continue on to the next section of the clinical affairs for the Neurorehabilitation and Community Reintegration Centers, I do want to remind you that you can upload this TBI surveillance report from our website. It's very long and very interesting, the way that it's written out. So I do encourage everybody, whether you're a provider or caregiver or a TBI survivor yourself, please check it out. Okay, so let's continue to talk about our clinical division and move to the topic of the two neurorehabilitation and community reintegration centers, one located in Charlottesville, Virginia, and the other located in Johnstown, Pennsylvania. These two sites are very unique, and I've had the opportunity actually to visit both. Both sites are set up to be intensive and structured DoD programs for active duty service members. And what I'd like to highlight in the next few slides is the multidisciplinary approach that both sites take on with every service member, which in turn maximizes their functional abilities in producing positive outcomes. Here you can see some of the treatment options which are offered at both sites. I have been with DVBIC for 4 years and have worked with various severities of TBI at the Johnstown Clinic. Within the last 4 years, though, I have also served in working with service members in recreational therapy. So with that in mind, let me give you a brief example of a multidisciplinary approach in making one soldier's dream come true. I met a soldier that wanted to skydive. And so since he wanted to skydive again, but after his injury, he could not be able to participate in such activity. And working with the physical therapy, occupational therapy, and speech and language pathology, and the other disciplines and the treatment options you see listed above, this soldier was able to make his dream come true. The idea that I want you to understand is that an activity that only seems to be fun, when approached in a multidisciplinary way, can lead to more than just a fun activity. The carryover from this activity I described to you helped the soldier in more ways than preparing to skydive again. It allowed him to appreciate and love life the way that he loved it before. Another positive outcome of using a multidisciplinary approach is treating co-conditions. For example, traumatic brain injury and PTSD. Many providers are faced with teasing out the similar symptoms they both demonstrate and figuring out which ones are from PTSD and which ones are TBI related. And since we all know this is no easy task, but I can tell you that with the collaboration of the various disciplines, a pathway to rehabilitation can be made more clearly for the treating service member or veteran. Here's a few more details about the two clinics themselves. Again, it's intensive, it's short duration, 90 to 180 days. Upon completion, the service members left the facility with these improved markings, such as in memory, decision-making, attention, problem-solving, which obviously it affects them in their everyday life, in their unit readiness, and their overall mission. There are no costs to the service member, and as you guys can see here, the program is fully funded by the DoD. If anybody does have questions regarding the clinics, please feel free to contact Commander James Blankenship. He is our government official, site director, and regional director. His phone number is posted here. He will be able to answer any of the questions you may have. Okay, so let's wrap up this overview of the Clinical Affairs Division by talking about the Regional Care Coordination Program. DVBIC began the Regional Care Coordination Program in November of 2007, and that was in response to the findings from the President's Commission on Care of Wounded Warriors regarding the case management, care coordination of wounded warriors, and specifically the population of warriors who had sustained a traumatic brain injury. So as stated here in the mission statement, the target audience is active duty service member and veterans who have a diagnosed traumatic brain injury and have ongoing symptoms. Here's also a quick link you can copy and paste on your internet browser. Okay, so the DVBIC Care Coordination Program is TBI specific and focused on making connections to the services that are appropriate to the care and treatment of service members and veterans who have sustained a TBI. Here you can see how case management involves direct management and planning of care while the service member is in treatment. The TBI care coordinators complement the case management team with TBI-specific expertise and resources. They are able to ensure that patients are connected once they leave the case manager's location. TBI care coordinators follow symptomatic service members across the country, not just their current location. And they can transfer a patient for follow-up to another TBI care coordinator in the network. TBI care coordinators focus on providing extra support and information to patients and family members to empower them and further their care in understanding of traumatic brain injury. When service members are medically evacuated through Lonsdale Regional Medical Center, which earlier today I showed you on the map, they are screened for a traumatic brain injury. If they screen positive, the network of TBI care coordinators are notified to follow up with them once they arrive for treatment here in the United States. Otherwise, TBI care coordinators take referrals and answer questions regarding resources from case managers, providers, family members, and sometimes service members and veterans call themselves. On our website, under DVBIC locations, you'll be able to find the regional care coordinator for your catchment area. Okay, so far we've covered a lot of information regarding the clinical division of DVBIC, and there is a lot more, folks, but let's switch, and now let's talk about the research division. The mission of the research division at DVBIC is to support researchers in this network in developing and conducting clinical investigations in traumatic brain injury. DVBIC's extensive internal and external collaborations allow for clinical innovation and research along the entire continuum of care of TBI, from initial injury, whether in theater or outside of theater, through medical evacuation, to acute and post-acute medical settings, rehabilitation, and ultimately a return to family, community, and work or continued duty. Here's also a quick link you can copy and paste on your internet browser. Let me review with you what our research goals and objectives are. And after this, I will let you know what you can do to be a part of the two current research programs. Our goals and objectives are to overall investigate the efficacy of interventions in preventing or treating the effects of TBI, conduct research across the entire range of TBI severity, whether it's mild, moderate, or severe, in both the military and veteran populations, develop and conduct studies regarding the incidence of TBI, as well as the unmet needs of the TBI survivors and their caregivers. Also, to conduct imaging studies in order to determine the pathophysiological effects of TBI and the physiological basis of treatment interventions. These goals and objectives are reached because DVBIC supports service members, veterans, families, and providers at our 18 network sites, which earlier today I told you that they can be military treatment facilities, VA medical centers, or again in community settings. These two research studies are ones that I'd like to tell you a little bit more about today. Natural history of TBI and the Caregiver Study. Some of you in the audience today may have seen this flyer or tent card around close to your facility or your military treatment center. If you have not, this is a copy of the flyer for the natural history of TBI. The quick link provided here will take you to the location on our website where you can find more information if you are interested in participating. I'm going to give you a little bit more details about that now. So let's get into some of those details regarding this study. I must first say that if you're a provider, caregiver, service member who may be interested in this study, please contact one of our research investigators. They really know these programs better than I would. Now, with that said, the comprehensive pathway, its purpose is to document the natural history of recovery from traumatic brain injury up to 15 years, to identify the long-term health care, mental health care, and rehabilitation needs of injured service members or veterans, and to create a database for research that contains clinical information on service members who were injured or deployed. The participants, there's the TBI group in this one, and those would be the service members who sustained a TBI since October 2001. That would be in OEF, OIF, OND. For those of you who are not familiar with that, it's Operation Enduring Freedom, Operation Iraqi Freedom, or Operation New Dawn. The second group in this is the trauma control group. Service members who sustained a bodily injury since October of 2001. The differentiation here is one is specifically TBI and the other one could be any other injury. Here's a little bit more information about the recruitment sites. Right now it's predominantly at Walter Reed. And the study procedures, as you can see here, is up to 5 intensive clinical evaluations over 2 days. And up to 10 telephone or web-based evaluations at home. That takes about 2 hours. Clinical interview and neurobehavioral as well. Okay, so same idea, but this is the brief pathway now. And this is the purpose to document, again, the natural history of recovery from TBI for up to 15 years and to identify the long-term health care and mental health care and rehabilitation needs of injured service members. Create a database for research that contains clinical information on service members who were injured or deployed. As you can see here, now there is another group that has been added to within the participation. One, of course, is the TBI group. Also, the trauma control group, the sustained a bodily injury since October 2001. But we also have the non-injured control group. And that would be the uninjured service member who was deployed during that time. Recruitment sites, Walter Reed, Naval Hospital, Camp Pendleton, or Naval Medical in San Diego. As well as anybody really that is able to research or get in touch with this research, many VA facilities as well. So as you can see, this information will be very helpful. And if anyone, again, is interested in learning more about this study and how they can participate, please call one of our investigators at 855-993-8242, or you can see the email here, natural.study2@dvbic.org. Okay, next research that I'd like to talk about. So the second study I'd like to talk about today is the Caregiver Study. We know and understand that family members most often adopt the role of the caregiver. Though non-family members may also adopt this role, and caregiver stress impacts both the caregiver's health-related quality of life as well as outcomes for the injured service member or veteran. So it is important to study the caregivers in addition to the injured service members. When we started to design a study to look at caregiver quality of life, we found a few measures or questionnaires with which to complete this research. Therefore, the purpose of the study is twofold. One, to generate information that policymakers can use to understand the healthcare needs and service members requirements for caregivers of service members with TBI. And two, to develop a measure overall of health-related quality of life in caregivers to be used in future research and by healthcare providers to improve their services. To do this, we'll conduct a study of the effect of caring for a service member or veteran within the moderate or severe caregiver's overall health and well-being. And we hope this will help us identify the types of healthcare and social services needed to create better caregiver psychological and physical health, social well-being, and resilience. Additionally, we will develop a new measure of health-related quality of life in caregivers to address the lack of available measures. After development, we will test this new measure, the TBI Care QL, to ensure it is ready to use in future research studies and clinical evaluations. Participants will include caregivers of a service member or veteran who sustained, again, a moderate or severe TBI. And on our website, we have a lot more information on the past and other current research projects, and I encourage all the listeners today, whether you're a provider, a caregiver, or a survivor, to navigate through our website I'm sure you can find a past or current research program which you'll find very interesting and beneficial for yourself. Okay, so let's move on now. Now let's focus in time on our third division, the education division. DVBIC provides a variety of educational materials, free of charge, of course, for service members, veterans, healthcare providers, and family members. We provide materials specifically focused on mild, moderate, or severe TBIs. And many DVBIC materials are available as PDFs, which can be downloaded. Hard copies are also available and can be ordered through our shopping cart on our website. So with these educational materials covering the following subjects, whether it's awareness and prevention, patient-family education, clinical education, in theater. If you're not familiar with in theater means, that means basic understanding is that you're deployed and it is during the time of conflict at war. Okay, trying to basically break it down for those that are not familiar with the in theater term, and also family caregiver curriculum. With the awareness and prevention, materials in this section include the signs and symptoms of TBI, coping and recovery tips, and information on how to avoid a traumatic brain injury. With patient and family education, these materials are intended to help patients and their families learn more about TBIs and recovery. Some materials are intended for providers to personally review with patients, while others are appropriate for display in your waiting area. Clinical education. DVBIC offers clinical tools for DoD and civilian providers, just as we had talked about a few of them already. Now, the purpose of these materials is to assist the primary care providers with the clinical guidance in assessing and treating service members and veterans who have sustained a TBI. And we're going to go over a few of those here shortly. In theater, most of these materials are directed towards military medical personnel for use in theater. All of these tools provide essential education for service members about TBIs. Family caregiver curriculum. These materials are focused on helping family caregivers of each or service members who sustained a moderate or severe or penetrating TBIs. These materials are filled with information that families need on a daily basis. And we will spend some time on this family caregiver curriculum today. Excuse me. So let's explore a little more about the educational materials which are offered. Here is copies of the signs and symptoms fact sheets for the MTBI and moderate and severe. These two-sided sheets are intended for all audiences, for those who present physical, cognitive, and emotional symptoms of TBI on the front side, and on the back side of these flyers, the coping and recovery tips. The mild version is also, I want to make sure to cover this part, the one that you see on your left, the signs and symptoms for mild TBI, is also offered in different languages, whether it's Spanish, Estonian, French, Georgian, German, Italian, Polish, Romanian. I might have left out a couple, but it's definitely offered in various languages. Here we have several other of the TBI symptom management tools. Military healthcare providers should distribute these to service members and veterans who have had a concussion, and the featured symptom, whether it's the memory, healthy sleep, or mood changes. The healthy sleep, for example, getting a good night's sleep has to do with many factors. Those of you that are involved in treating TBIs, you know that having a good sleep hygiene can help treating a lot of the other symptoms. Or if you're the service member listening in today, I'm sure you would agree that once you are able to get good sleep, you'd be able to focus better on the other treatment options. Now, another common symptom that we also see is a headache and neck pain. And again, as mentioned earlier, was dizziness. And you can also find these ones listed on our internet site that are going to look very similar to these. Okay, family needs line. The first booklet here that you see addressing family needs, this booklet highlights building overall stronger family ties, improving communication, The transitioning home. Very popular topic here, driving after a traumatic brain injury or avoiding substance abuse. The next two, talking with children about TBI and talking with children about moderate or severe TBI. These booklets offer communication techniques that can help you explain the effects of TBI to children, but in the way that they can understand. It includes tips for every age group, from toddlers to teens. And the last booklet here that you see pictured, titled Taking Care of Yourself While Caring for Others. This booklet offers coping techniques for caregivers and families who are trying to manage stress, anxiety, or sadness while caring for an injured service member or veteran. Excuse me. Experts provide advice on relaxation and self-care. The tips that are included in here is emotional health, sleep, diet, exercise, and overall strategies for self-care. Providers, listen up. Here's a great tool available to download PDF from our site, as well as a mobile app on either platform, Android or iPhone, is the Co-Occurring Conditions Toolkit for the Mild Traumatic Brain Injury and Psychological Health. This one always excites me. In June of 2009, the Department of Veteran Affairs held a consensus conference on concussion, post-traumatic stress disorder, and pain, with the goals of providing a consensus recommendation on the treatment of veterans with these comorbid conditions. And based on the reviewed literature and consensus opinions of the SMEs, or subject matter experts, from the VA and the Department of Defense, they determined that the treatments recommended in the VA DoD clinical practice guidelines are still recommended in the comorbid population. And there was not evidence to suggest that the current CPGs were contraindicated. And there are several excellent VA DoD CPGs that address concussion, PTSD, depression, etc., or the substance abuse disorder. And these CPGs are intended to address the care in a non-deployed setting. However, there are areas within the CPGs, the clinical practice guidelines, that may present challenges should a patient present with multiple conditions. This guide right here, this guide attempts to address these areas of conflict. Given the occurrence of co-occurring conditions, a holistic approach that works to incorporate all spheres of the patient's life is essential to include family and spiritual aspects. Now, while medications can be very effective, this patient population is at risk for polypharmacy, which may lead to significant drug-to-drug interactions, or utilizing non-pharmacological approaches where indicated and appropriate is critical. Or emerging research in the area of complementary treatments in this population may indicate therapeutic alternatives in the near future. This co-occurring conditions toolkit, providers, I definitely encourage you to take a look at it. Also available here now, also available PDF and mobile application, again, either on the Android or iPhone platform, is the MTBI Pocket Guide. You can quickly access a comprehensive reference guide that reflects current clinical standards of care. Physicians, physician's assistants, nurse practitioners, and related treatment and therapy providers can find information on assessing, treating, and managing common symptoms of MTBI patients, including TBI definitions, causes and severity ratings, DoD MTBI clinical guidance, and VA DoD CPGs, clinical practice guidelines, for symptom management, summary of clinical recommendations for cognitive rehabilitation, and driving assessment after the MTBI. Okay, still a little bit more about the education. Concussion and MTBI information pamphlet. This pamphlet was developed by subject matter experts from the DoD and the Department of Veteran Affairs to educate the deployed service members about TBI 1 month or more after the injury. Military healthcare providers can distribute to service members and veterans who are experiencing TBI symptoms more than a month after the time of injury. So what happens if it's less than a month, right? That's my next question. Well, here we go. This pamphlet was developed by subject matter experts, again, by the DoD and of the VA, to educate the deployed service members about TBI right after the injury. And again, providers can give service members who are in the acute stages of recovery of concussion with deployed settings this educational brochure. Here we have the complementary and alternative medicines, modalities, and interventions. So what is CAM, right? CAM is a group of diverse clinical and health practices and products that are not presently considered to be part of conventional medicine or accepted standards of care. They are where alternative medicine is used in place of conventional treatment. Complementary medicine is used in parallel with conventional therapies, or integrative medicine synergistically combines conventional and CAM treatments to achieve safe and effective care. So as you see here, you can see the traditional Chinese medicine, Native American herbalism, for example, some sections of the whole medicine systems, or mind-body medicine. Spiritual prayer-based practices, biofeedback, meditation, or in the very last section, biologically based interventions, botanical medicine, clinical nutrition therapy, etc. Okay, now there are many more educational tools which I can reference in today's webinar, which are either on our website or DECO or Brainline or Military Brainline. But now I'd like to share with you one more educational tool that is offered. This is the Family Caregiver Curriculum. This is a source of information and support for caregivers of service members and veterans with moderate to severe TBI. This is the result of a congressional action and cooperation from a panel made up of TBI survivors, family members, and experts appointed by the White House and the Departments of Defense and Health and Human Services, also DHHS. DVBIC was selected to facilitate this process because of its nearly 20 years of service to active duty military, their beneficiaries, and veterans with TBIs. Module 1, which you see right here, covers the basics of TBI and recovery, anatomy of the brain, how TBI can affect many physical, cognitive, communication, behavioral functions. What is the Glasgow Coma Scale and the Rancho Los Amigos Scale? Actually explain those. Potential complications and the overall uniqueness of the recovery process. Let's sit here on module number 2 now. This module explains in more detail the physical and emotional effects of TBI. It also explains how caregivers can help their family members deal with these issues. Important topics that are covered in this section. Physical effects again, cognitive effects, communication effects, behavioral and emotional effects. Now in module number 3, this module is all about the caregiver. It offers tips on how to organize life as a caregiver and encourages caregivers to take care of themselves during this stressful time. Important topics that are covered here. How to manage caregiving. How to organize medical and military records, which we know can be very confusing and they can add up very quickly, especially in the moderate to severe TBI. Or how to become a better advocate. Most importantly, how to avoid caregiver burnout. Or building a support network. Or what are your legal options available to help the caregiver plan for the future? In the last module here, in module number 4, this module explains how the disability rating system works. It describes how to get services and benefits that can help you take care of your injured family member. Important topics again that are covered. Guide to military benefits and services. Pertinent information about the Disability Evaluation Board. Services available to both the service member, veteran, and families in regards to health benefits, counseling, behavioral health benefits, education benefits, legal, and travel as well. Okay, now for any providers in the audience, you can find the information and a lot more information on many of our online courses which we offer, which includes webinars. And our current schedule for 2013 is posted as of any of the prior webinars we've had. Here's also a quick link that you can just copy and paste. Okay, before we get to the end here, I'd like to share with you a little bit more about what my position is overall as a Regional Education Coordinator, or REC. I can offer or present, perform outreach, conduct patient and family education classes, provider education and exhibits, and a lot more within the 10 states that Ms. Giovanniello mentioned earlier. Well, DVBIC, again, is very unique in that there are 15 regional education coordinators here in the United States. And between the 15 of us, we're able to cover, again, the United States and our international location in Germany. And overall, our team promotes awareness, prevention, and up-to-date TBI information for service members, veterans, families and providers, and the community. And as everyone in the audience knows, government funding can be delicate at this time. So I can tell you that we are equipped to deliver presentations via teleconference or video conferencing as well. So if anybody in the audience would like to know more about the REC in your region, please log on to our site, again on site location and maps, and you can find a regional education coordinator as well. So as I wrap up today's webinar, I'd like to recap with you. DVBIC supports service members, veterans, families, and providers at our 18 network sites, which can be military treatment facilities, VA medical centers, or community settings. And we have many resources for providers, survivors, or caregivers. And the collaboration, the New York Brain Injury Association, to be able to present today is a good example of how we are working hard at our mission, and that is to serve the active duty military, the beneficiaries, and veterans with TBIs through state-of-the-art clinical care, innovative clinical research, initiatives, and educational programs. With that said, Ms. Giovanniello, I'd like to thank you again for the opportunity in presenting today, and I hope that the audience today has found the information useful, and I'd like to turn it back over to you.
Thank you, and we appreciate this collaborative effort. I think this was a wonderful opportunity, and it is for a very important cause. We do want to help our service members, our veterans. So thank you, José Luis, for doing this. Just a few quick reminders before we move on to the question and answer session. We do have some end slides. Jose, do you mind just advancing to the next? Thank you. For those of you that don't know the Brain Injury Association of New York State, we are a statewide nonprofit membership organization that advocates on behalf of individuals with brain injuries and their families. We have a lot of wonderful things coming up, a lot of events. This is our contact information if you would like to get in touch with us. Also, again, I'll repeat, you will be receiving my personal contact information in an automated follow-up email from GoToWebinar, so please feel free to direct any questions to me. Any questions that are unanswered today for whatever reason, whether we run out of time, please don't forget about them. Please send them to me. I'll be happy to get them to Jose. I know he'll be happy to answer them. Please check our website for updates about upcoming webinars. Like us on Facebook if you like the webinar. We do love our following, so thank you to anyone out there who has already shared the BIANYS webinars. We have some wonderful events. We have our webinar updates. We will be having a Warrior Salute webinar next month, so stay tuned. Check our website, www.bianys.org, for any updates, recordings, slides. Join us for our 31st annual conference. If you'd like more information about that, there is a link at the bottom you can visit to find out more about it or to register. We would love to see you there. I am actually going to turn this over to Jose again. We are going to have a question and answer session for the rest of time that we have. We have about 15 minutes. So anybody that has questions, we do have some already coming in. Please feel free to type them into that question window on your toolbar. For those of you wondering about recordings, we will hopefully have this up before the end of the week. So if you would like a reminder email from me, just shoot me an email and I will be happy to send you the link once it's available. Otherwise, you can continue to check our website. Again, it's www.bianys.org. There is a webinars tab. It's under resources, and it will show up there, like I said, hopefully before the end of the week. I'm going to get into some of the questions now. The first question is, who is eligible to go to the Johnstown, PA facility, and what is the cost? How long can they stay? I think you covered some of these in your presentation already, but this individual would just like to know some of those things about
Sure. Yeah, absolutely. You know what? Commander Blankenship will be able to address any of the admission questions. Let me give you that phone number again. Give me 1 second, please. I don't have it here off the top of my head. I know it's 434 something. There we go. Oh no, I lost it. Yeah, but while I look for it, though, basically the answer is please contact Commander Blankenship. He will be able to discuss the details regarding the admission or any other costs, etc. I can tell you though, right now, currently, as far as for costs go, the program is fully funded by the DoD. Housing and meals are provided, no cost, etc. Traveling costs getting to the facility, things like that. Here's Commander Blankenship's phone number. It is 434-984-5218, and he will be able to address any of the admission questions regarding both sites since he is the regional site director.
Thank you. I do have another question from an attendee. I believe that this is a question concerning the TBI surveillance number breakdown that you showed earlier. There was a category of severity that was listed as not classifiable, and this individual would like to know a little bit more about what that category entails. If you could just explain the not classifiable category of severity.
I knew it. I knew that was going to come up. You know what? I did a lot of research on this one, and basically, from my understanding, okay, is that the non-classifiable one is that they knew that an injury had occurred and has occurred, but there's a change within the diagnoses, whether it would be mild to moderate or to severe. So that would change. And those numbers got put into the non-classifiable. There's a really nice breakdown and explanation on the actual report itself and what those numbers really mean. And I'm doing it no justice whatsoever right now, but I can tell you that in the report itself, it does break it down. And again, from my understanding, it was one of those where it was shifting based on trying to see whether it was a mild or moderate type of injury.
Thank you. Another individual has made an observation that the local VA medical center near this individual does not seem to refer many clients to DVBIC, and this individual wants to know why that might be or how to promote more collaboration or more referrals to DVBIC.
Sure. Well, I guess it all depends on the services that are being sought. On what it is, whether it's education or referral for the regional care coordination program or admissions or for Commander Blankenship. How can, I guess the question is, how can this person find out more about DVBIC? Or? Can you tell me
Yeah.
the question again? Yeah.
Yeah, this individual just feels like not many referrals are being made at this VAMC,
Oh, okay.
and she would just like to know, I think, how to, I guess, promote more referrals or to get more involved with DVBIC.
Sure, absolutely. Well, I guess the first step would be to contact me, and then we can figure out exactly what this individual population that that they want to be able to have services delivered to. Uh, that's the first step. Just calling me, and then we can figure out how we can get more either information or resources over to you. And if it's not within my 10 states that I work in, there's going to be another REC somewhere in this country. There's 15 of us, that can help you out and connect you, whether it's in the research division or in the clinical or in the education, either one of our 3 divisions. So again, the first step is call me or email me, one of the 2.
Thank you. I think this is a similar question. This individual just wants to know if you or if another, I'm guessing REC, could come to a location maybe in New York and provide training. I'm guessing that you guys would be happy to do that, but this
Yeah,
individual was curious.
yeah, no, absolutely. No, we get requests often, if not every single day, throughout the country and in Germany. But as everybody knows, the budget is just not very feasible right now for travel for all government in general. So it depends again on the function and things of that nature, the target audience, or personally, I like working over webinars, or video conferencing. I've done many of them, so it can save us time, energy, money, and we can actually get the same job done. So if I can't actually travel to New York and that individual has connectivity where they can use Skype, for example. I'm not promoting Skype, but as a general term, yeah, we can link up and we can definitely do a training. And if not, then a video training, I can send out a CD. There's many opportunities besides just being physically present there. So, yeah, absolutely.
Excellent. I did have a question about the slides. Again, I will be posting the recording. The slides are actually already up and available for download. They are on our website. If for whatever reason there's a problem finding them or downloading them, please just send me an email and I will be happy to send them to you as an attachment. Again, my last name is rather long, but my email address will be provided in a follow-up email that's generated by GoToWebinar. So you can use that, contact me if you have any issues, and I will be happy to get you those slides. It looks like we're down to the last question, so I encourage anyone to send in their question if they haven't received an opportunity to ask it. This individual just wanted to know if you wanted to mention info available from Texas A&M on caregiver issues, more specifically T-Care.
The T-Care program, or?
I believe so.
You know what, I wouldn't have enough information to feel comfortable talking about it immediately.
Okay, so I guess to that individual, if you would want to send an email to José Luis or send an email to me, I will be happy to get it to him.
Yeah, please, yeah, and then, yeah, we could definitely have a nice conversation or communication with that. Yeah, that'd be great. Please.
All right, it looks like those are all the questions I've received. So I guess on that note, that concludes our webinar presentation. Thank you again so much, José Luis, and thank you all for participating. Again, we really do appreciate the support, so keep on sharing the news of our webinars, keep on tuning in, and I hope everyone has a very wonderful day.
Thank you. Bye-bye.